Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
Ever heard of Ouabain? No, I didn't think so. It's also known as g-strophanthin. Well, did that help? Probably not. Hi, everybody. I'm Dr. Mitch, and today I want to discuss a little something that you may not know about, but extremely important hormone from the adrenal glands that few, if any, have ever heard about. And its potential is major importance, especially in cardiac health. Actually, Ouabain is a cardiac glycoside and basically a tonic for the heart. And I'm always aware of this hormone because in mice that have been adrenal lectomized, they have very little bit when they try to assay and find it. And basically, these insufficient patients as well have basically low plasma endogenous Ouabain levels. They found that in patients too, with very low levels of this of the hormone, especially coming from the adrenal gland or adrenal failure. So when you're doing your saliva test, and think about that, you may be finding patients that are very low in a cardiac glycoside that's extremely important for the heart. And that's why we're going to be doing this as part 1 of 3 over the course of the next several weeks. I think it's that important. The adrenal cortex is the most primary area where circulating Ouabain and aldosterone are biosynthesized and share basically a requirement for progesterone as well. Now, regrettably, the biosynthetic pathway for Ouabain still remains somewhat unresolved, so to speak. Now, studies showed that a low dose of angiotensin II acting with the CNS, the central nervous system, upregulates circulating Ouabain, basically. This in turn stimulates downstream arterial monocyte mechanisms that lead to vascular tone and long-term blood pressure. However, it's interesting to note that digitalis, a close cousin to Ouabain, and even more interesting is they found that Valdez, a researcher et al., observed that immunoacidable digitoxin, DIG, was found regularly in neonatal plasma. And this is because it was unlikely, although it's not impossible, that this immunoassay was actually measuring authentic digoxin. No, it probably was measuring the blood contain the Ouabain, which is a sodium pub inhibitor. Ouabain is a cardiac glycoside. It's a compound that we find in some plants. And I will talk about that later because it's peculiar in African plant species known as the strophanthin gratis plant, which was originally known as a blow dart poison that the Madagascar Indians and others would have synthesized through cooking, etc. It is known for its ability to inhibit the enzyme sodium potassium ATPase, which plays a critical role in the regulation of the gradients across the cell membranes. This inhibition leads to an increase in intracellular calcium levels and calcium cardiac muscle tissue, resulting in enhanced contraction force involved in the cardiac output. If you're starting to get the focus here, even though this is a little bit late in biochemistry, you'll see that it's going to help the heart pump harder. Ouabain has been studied for the potential, basically therapeutic effects of the heart, including its ability to protect the heart under conditions, particularly like protecting the heart by doing several different areas. Now, there is a positive ionotropic effect that we did suggest a moment ago. There are many other ways that the heart is protected, and we'll get into it in part 2 of how Ouabain, this little known substance that basically we clearly believe is coming from the adrenal glands, yet we can't measure by typical assays, but we should be aware of, because if the adrenal glands have low other cortex hormones, we suspect that this is low as well, and it should prompt you as the clinician to do something to protect your patient's heart. I believe as we go through these several components, you'll get the hang of this. It'll make a lot more sense and what we need to do, and believe it or not, can make a huge difference in the outcome of some potential patient with either having a heart attack or otherwise. Thank you so much for watching. This is Dr. Mitch Ghen. If you need further information, just go to drmitchghen.com. That's drmitchghen.com. More to come.